Hello and welcome to this episode of Health Coaching and Beyond from Peak Health Coaching. Today, I'm delighted to be chatting with Tim Williams, and we're going to be focused on the topic of supervision by popular demand. So, we're going to kick off by asking Tim then, what is supervision and why is it important, Tim?
Yeah, well, I don't think people will be surprised to hear me say that supervision is about providing an environment for people to think really well about their coaching practice and what they're doing and how they're working with their clients. But it also, I suppose, for us as supervisors, it's really important that those coaches out there are doing really good work and doing work to what we consider a really good standard. So there is a kind of a normative part to that about the standards, but also there's a developmental part, there's a formative part to supervision, and there's also a restorative part. So there's kind of making sure that we're looking after our health coaches. And I suppose that's kind of speaks to a little bit why it's really important. So it's important because we want to make sure that the clients or the patients at the end of the day are getting the best service. It's important that coaches develop, and it's also important that coaches are looked after, I would say. What do you think?
Yeah, yeah, no, lovely. Yeah, no, I'd go along with that. I agree with that. And I mean, in terms of health coaching supervision specifically, is there anything that you'd say makes that different and distinct from supervision more generally?
Yeah, that's a really good point. So, because we hear about kind of lots of different types of supervision now, and I think that people
Mm.
sometimes get a bit confused between the different types. So, I know in the workforce development framework, they talk about a line management supervision, which is kind of the people who are be looking after you from kind of an operations, a day-to-day kind of aspects of your work. And then there's the clinical supervisors who are maybe probably the GPs in the primary care network who take on that role and the people to go to with your kind of clinical questions that you might need some input on. And I think a lot of places have been using the clinical supervisor as the coaching supervisor. And I think what we're talking about here is health coaching supervision, which is distinct from those two. So really focusing on the health coaching skills and approaches that a health coach would use. And it'd be really difficult, I think, for other supervisors to supervise that type of work, which is why I suppose we've responded to the need and provide it. And I suppose really why I ended up training as a supervisor because there were lots of people out there not getting coaching supervision. They were getting other supervision, but not getting the coaching supervision. So those are the three things that I think about. Is there anything else to add?
Mm. Yeah, no, I think you're right. I mean, and I think particularly that the practice of health coaching is quite particular, the kind of tools and techniques that you're using. And so to have a health coaching supervisor to support that seems important. But also I think in terms of looking after the health coach, and understanding what that experience might be like for them being in a coaching session and how they might be impacted by that personally as well as professionally. I think that having a health coaching supervisor is key really in supporting, their well-being really as a professional.
And there's another thing as you were speaking there that I was thinking about that actually, as a kind of a lone practitioner, it's also really difficult to know, I suppose, whether you are doing the right kind of stuff.
Mm.
And therefore having someone that you can kind of check in with on a regular basis and maybe kind of gets to know you over time can be really helpful. Otherwise, I think it can feel like, and we've heard this from folks, it can feel like quite a lonely place. I think out there because you're just maybe in your room, you're seeing people one to one, you're maybe not having loads of interaction with other people, which is a shame. So supervision and group supervision in particular really gives people opportunity to, I suppose, benchmark how they're working with other people. I think that's useful too.
Yeah, I think so. And I think as well, I think there are some things that are not quite cut and dry, particularly around scope of practice, which we hear more and more people kind of talking about in relation to the evolving profession of health coaching is, what is your scope of practice? And I think whilst you can reflect on that as an individual, actually having a supervisor there that you can bounce off and actually discuss that with and that gets to know you over time, I think could be, really valuable as well.
Yeah,
So,
I agree
Tim,
with
tell me a bit then about your journey as a health coaching supervisor. What's made you interested and how have you developed your supervision practice?
Yeah, well, obviously it starts with being a coach, and I was a coach for a number of years as a professional life coach with the Yorkshire and Humber Deanery. That's how I started off. That's over 10 years ago now. And I suppose, yeah, 7, 8 years in, I was. I suppose I was responding to that need. We'd started training health coaches in the NHS, and we were hearing back that actually people were not getting coaching supervision. The Personalised Care Institute, I think, kind of laid on some finances for people to get some supervision, and we stepped up to that to kind of think we maybe kind of fill in a gap to some degree. But I'd already started that journey of getting some health coaching training, so I trained as a time to think coach as well, and a time to think coach supervisor. And then I went on to get a diploma in coaching supervision with the International Centre for Coaching Supervision. And yeah, and I have to say, having done those two different courses, I've kind of found my way back, I think, to coaching in a supervising, sorry, in a thinking environment. I think that's where I've kind of found my home, I would say. Um, so that's what I offer. It doesn't mean that I only offer one type of supervision. I'm versatile. I can offer different types of supervision. And when we teach people, again, supervision skills, we don't want to just say, this is how you do it. Don't do it like us. We want people to kind of supervise like them. That's what we want. But we want to give people a breadth of, I suppose, understanding and different skills that they can use. So it was responding to a need. That's how I kind of found my way to doing it.
Yeah, lovely, lovely. And I really like what you're saying there about essentially finding your identity as a health coaching supervisor and working out, yeah, what's the angle that resonates with you really. So yeah, lovely to hear that around the thinking time. So what would you say then, reflecting on your extensive health coaching supervision career, what's been most rewarding for you about your experience in that role?
Yeah, well, I love coaching supervision. I think I love it even more than I do coaching, and I love coaching. And I think what it is spending time with people who I suppose they get it to some degree. They know why they're coming. They know what coaching is about. They know they're not coming for solutions, although some people still ask for solutions. They know they're not coming for solutions. So I think the most rewarding thing is working with people who are doing such incredible, important work, and supporting them to do that and do that at the very kind of cutting edge of their I suppose ability, but also I suppose pushing them even further than they thought possible. So I suppose it's helping people to grow into that identity that you were talking about, their own identity as a supervisor, and as a coach. I suppose that's what I like.
Wow, lovely. Yeah. I mean, I think just in terms of my own sort of journey as a supervisor, I think a little bit different because my background has been in working in education, kind of first in teaching, then getting into academia, kind of a long wiggly route to kind of get to where I am now. But I guess my supervisor journey started through my academic work, supervising undergrads and postgrads in research supervision. And actually, that style of supervision is a little bit different from health coaching supervision in the sense that it draws on a mentorship model with a more experienced academic mentoring early career researchers, but still supporting them to come up with independent and original research. So in that sense, kind of not sticking your oar in, but enabling them to draw out their ideas, not yours. So the kind of the idea of toy. Um, as I've evolved my supervision practice, I've drawn very much on Amartya Sen and his capability approach, and that a kind of a notion of agency that seeking to empower people really to tune into what they have reason to value. So it's funny because actually looking back, I feel like I've been coaching through my supervision for a long time, and so ultimately that has evolved my a kind of a coaching approach to supervision from quite an early stage, really.
Yeah, nice one. I'm just going to pick up because you mentioned toy there. And not everyone, I suppose, will have been on our programs, but t toy stands for their ideas, other people's ideas, and then your ideas at the end. That kind of hierarchy of ideas. So yeah. So Caroline, what are the parallels then you see? I mean, you've mentioned some already there, but is there anything more the parallels between the supervision that you've kind of grown up with and
Yeah.
health coaching supervision?
Yeah, well, I think it is about that enabling people to think well for themselves, to have that kind of autonomy over the decisions that they're making and whatever it is that they're doing. So I think whilst the academic supervision has been focused around, a research project, a doctoral study or something like that, What I realized pretty early on in my academic career is that life kind of happens, and you're working with doctoral students over often a number of years, and often at a kind of stage and phase in life where things kind of happen, personal challenges, health issues, family illness. A lot of candidates supporting elderly parents, managing bereavements, and then also career life, big transitions really in terms of relationships, careers, and kind of things like that. And so for me, that kind of coaching approach to supervision kind of segues certainly into well-being coaching. And I think you could probably argue health coaching kind of realms, as well. And of course, in academia, you would have kind of well-being services and other kind of places that you can signpost students to. But actually, as a one-to-one supervisor, particularly for doctoral supervision, you are the first port of call, and you're usually the person that knows that individual best. And so again, kind of reflecting and looking back, although it wasn't called health coaching and that wasn't the role that I was in, I can see that through the supervision work that I was doing, there's actually a lot of resonance with what you might do, both as a health coaching supervisor and as a health coach. And actually, I think I've brought a lot of that into some of the stuff that we do at Peak, because a bit like you were saying earlier about the peers being able to support people through group supervision. I think some of our practices around setting up action learning sets, trying to maintain contact across training cohorts, some of the ongoing CPD sessions and things like that we've offered. Actually, what's at the heart of that is trying to connect people together in ways that they can be mutually supportive. And so I think in that sense, I think sometimes those kind of communal learning environments that we're setting up also resonate with that idea of supervision. Um, yeah.
Yeah, it's fascinating, isn't it? How all of these kind of things link together and all these things that we've been kind of doing over our lives are kind of all kind of come together in what we're doing now, which is great. What do you think's kind of coming down the track then for supervision and supervisors? What are you noticing?
Yeah, well, I mean, I think there's, to be honest, I think there's quite a lot going on in terms of health coaching in the UK, and I think more in that kind of global environment as well. I mean, what immediately springs to mind is we've obviously had the NHS England Workforce Framework for Health and Wellbeing Coaches came out now a couple of years ago. And of course, NHS England is also, massive transition kind of happening there. But nonetheless, in their framework guidance around health and wellbeing coaching supervisors, they did recommend that folk get themselves to tier 3 in terms of their own health coaching practice before, training up to be a health coaching supervisor. So that's kind of quite interesting in terms of a benchmark standard for, kind of what sort of background people might be coming into that role with. Since then, we've seen the Personalised Care Institute evolve their own supervisor standards, and accredit supervisor training. And of course, we're one of those accredited providers now offering that 6-day course for one-to-one and group supervision. So I think we are sort of seeing both a professionalization of health coaching supervision, but also roots into health coaching supervisor training. So I think that's been really great progress. The other thing that's coming down the track from spring next year is that the UK and International Health Coaching Association are going to be making supervision a mandatory requirement for their full members. So they're kind of full health coaching members will need to kind of have that supervision in place. Up to now, it's been recommended, but not kind of required. And again, I think that is part of this bigger movement to professionalize health coaching as a discipline. And then there are other kind of wider organisations people could look at, such as the EMCC, so the European Mentoring and Coaching Council. So that's not just health coaching specific, but it's coaching more generally. And they've got standards for supervision as well that people can look at. So, I think quite a strong picture really of showing how important this role of health coaching supervision is, but also showing people the pathways that they can pursue if they want to kind of take it up themselves.
Yeah. Wow. Okay. So it feels like it's if we didn't think it was important before, it feels like it's really important right now, from what you're saying there. Yeah. Okay. And I suppose maybe I don't know if there's anything more one kind of add, but I also want to kind of touch on because I think it might be interesting, kind of how we might get people to prepare really well for supervision. So now they know it's really important. How do they prepare? So I don't know if you want to take yourself back to your doctoral students and how you got them to prepare for a supervision session. What kind of things came up?
Yeah, well, turning up.
Yeah, that helps. That helps.
Yeah, yeah. I think getting the timing right. I mean, I think, and I think again there are some sort of parallels, particularly when you know doctoral supervision. It's the dates not actually naturally in the library, not in the library. The dates are definitely not in the library. They're not naturally in the diary, and there's a kind of a concertina approach to supervision timing. I think that it might be useful here. So, you know, at the beginning of someone's doctoral journey, they might find it useful to have several supervisions fairly close together. Then they might be fairly confident with what they're doing and might be doing field work or something, and they want to sort of stretch them out. But then there might be other times when actually it's useful to have them a little bit closer together. So I think that kind of the rhythm and pace and frequency of supervisions is, yeah, I think there's some perhaps some resonance there for health coaching as well. How about yourself? What would you kind of put forward as your pearls of wisdom around health coaching prep
Yeah. Well,
supervision?
turning up is definitely important. Def Definitely important, I would say. I agree with that. And yes, I suppose being flexible, isn't it? It's being flexible to kind of respond to what's needed in the moment. So yes, it's great to have these kind of regular sessions booked in, but sometimes you just need to have a conversation with someone and within a short period of time, and hopefully people can find a supervisor who can flex to that as well. In terms of people preparing for themselves, I suppose that there are three questions that I kind of send out to folks. One is to kind of for them to think what is an issue for them at the moment relating to their coaching practice. You know, what's going on for them. You know, maybe you also maybe what's going on for them personally. Again we want to treat people holistically. It's not just about the work. What how we're showing up will also influence the work. So what's going on in our lives is also important. So what's an issue for you at the moment? The second question is like, what's the outcome that you want for that issue? Again, getting people to be really specific about the outcome that they want. So people can do this work before they come. And then when they've got the outcome and it's clear and they've written that, articulated that, and they've written it down, then the last question is like, you know, bearing that in mind that that's the outcome. Um, what's the question if you could answer it that would get you closest to your outcome? So what's the question if you could answer it that will get you closest to that outcome? So if people arrived at supervision with that question, that would be great. Now, I'm aware that there's a whole lot of stuff that goes on in life. So generally speaking, people come sometimes to a supervision session not really sure what they want to be supervised on. And I think that's okay too, because as you would expect, I will give people some time just to think and just to almost unload what's going on for them. And out of that, we will often find the issues and then the outcome and then the question that they maybe want to ask me to think about. And then we'll have a bit of a dialogue about that before maybe there's an opportunity for me to offer some insights if that's useful and if it's asked for. And then an opportunity then for the supervisee, for the coach to then consider, okay, so now we've had this conversation, what does that mean? What am I going to do differently? What am I going to change? How am I going to approach this situation? But a bit of prep first, I think, is you make the best use of everyone's time. That's what I think. Everything, if there anything more to add, Caroline?
Mm. I mean, I think that's really useful. I really like that kind of those kind of different stages around that kind of the issues to questions. I think that's a really kind of useful kind of exercise. I guess, I mean, listening to you speaking there, there's something about contracting. I think that's in there about that kind of how you're contracting for that session, and yeah, you know, how are you showing up to the supervision? How would you like your supervisor to be? You know,
Mm.
how can they be in a way that's going to be as most helpful for you to resource you, that
Yeah.
kind of thing. Yeah, I think a lot of food for thought really there in terms of yeah, both the supervision session itself and the preparation. But I guess the one thing I would add is just also thinking around the follow-up. So having had that supervision session, having made the time, having shown up, all the rest of it, how do you follow up on that? So you know, is that personal reflection? Is it kind of actions? You know, what's the follow up for you? And I think that's for each individual to think about for themselves. But yeah, no, some really great insights there, Tim.
It made me think actually the other thing that is really useful is people carving out some time after a supervision session to do exactly as you describe. So yes, often at the beginning of the session, I'll just check in with folks as part of contracting. We've got until whatever 11 o'clock. Is that a hard cutoff for people, or have we got a little bit of time? Now, it's not because I want to overrun the session, but what I want is the people to get to 11 o'clock kind of feeling easeful, and if they can have carved out 15 minutes just to kind of reflect on what's gone, because there'll be a load of learning in that session for people, especially in a group session where they'll be learning quite a lot from each other. Just having that 15 minutes gap where they can kind of reflect, maybe write some notes, great for logging their supervision hours as well, would be really, really important. Not just to log the hours, but to kind of do the reflection, as you say. Yeah.
Yeah, absolutely. Okay, well, I think we've given people a bit of food for thought there. I'd be really interested to hear, people's reflections, comments, feedback. So if you've enjoyed listening to this podcast and you'd like to share anything back with us, we would love to hear from you at peakhealthcoaching.com. Get in touch. Until next time, thank you very much, Tim, for joining me today. And until the next one.
Thanks, Caroline. Okay. See you.